Nationwide survey from Myriad Genetics shows that many women fear cancer screenings, yet most say genetic testing would actually give them some peace of mind.
And joining us to share how knowledge of family history and genetic risk can help women take control of their health care, OB/GYN Dr. Stitt and patient with hereditary cancer risk, Jody Lavery. Ladies, thanks for joining us here. We appreciate it.
Good morning. Thank you for having us.
Absolutely. Dr. Stitt, the survey found that 80% of women are afraid to get screened. That's frightening in and of itself. Yet most would just feel reassured by the results. Why do you think there's such a disconnect with this?
Yes, good morning, and thanks so much for having us. Such an important topic especially during Breast Cancer Awareness Month this October. But I think women are so busy these days, especially so many women in their 40s, 50s are in a sandwich generation where they're not just taking care of, their children, they're also taking care of their elderly, family members. They're very involved in their work and their communities. And there's so much that women are juggling on any given day. And I think when it comes to their health, they're often avoiding their mammograms and their screenings because they're so busy doing everything else. So any additional piece of information that might disrupt the very carefully balanced, barely balanced, I would probably say, construct that they have, can be really daunting. But I encourage my patients that, you have to, having no news is not good news. You have to be aware of what's going on. And part of that is knowing your family history and taking that into account and having those discussions with your clinicians.
All right, and Jody, you actually have a family history of cancer. Can you share what led you to pursue genetic testing and how it's impacted your outlook?
Absolutely. Good morning. My grandfather had male breast cancer and his mother. And knowing that I was that much at risk, I spoke with my provider and she recommended the MyRisk hereditary cancer screening test. I went ahead and had the test done. And I did come back BRCA2 positive mutation. And although getting the test done was scary and waiting for the results was even scarier, knowing the results was empowering. I was able to make decisions on my health care that I may not have been able to make if I had a cancer diagnosis. So getting tested is very important, and being able to manage your health care.
Absolutely.
And Dr. Stitt, talk to us about how knowing your family health history, how that combined with the genetic testing, how does that give more women control over their own health?
I like to think of it as an additional vital sign. When you go to the doctor, you're very used to getting your blood pressure, your weight, your temperature checked. Your family history is an equally important vital sign. It gives us insight into whether, into additional screenings, additional things that we need to do as clinicians. As we head into the holiday season, October, November, December, often a time where lots of families are getting together, and a perfect opportune time to ask your family members and update your family history. Find out if you have a lot of similar cancers like Jody did, breast cancer on the same side of the family. Ask if you have young people in the family, people under the age of 50 that have developed some of these cancers, because that's not typical. And also look for rare cancers. Jody's grandfather had male breast cancer, which is one of those rare cancers, ovarian cancer, pancreatic cancer. With all that knowledge, you might be a candidate. If you carry any of those, you might be a candidate for the MyRisk hereditary cancer test with RiskScore. This is a test that will give you additional information, allow your providers to make an individualized care plan for you. Maybe it's surveillance, maybe it's preventative surgery, but it's something that's individualized for you.
Okay, and Jody, for women who are watching who may still be hesitant, what steps can they take to start that conversation with their doctor?
Like Dr. Stitt said, talk to your family, get your history, share that with your provider. Let them know that you heard about the MyRisk hereditary cancer screening test and want to get tested and know. And, knowledge is power. And with that power, you can make decisions in your healthcare that you may not be able to make if you get a cancer diagnosis.
Right. We see so many more cases throughout the years with so many more people being affected. So this is great that we bring it up here during Breast Cancer Awareness Month. Dr. Stitt, where can viewers go for more information on this genetic testing?
I would encourage each one of your viewers to go to getmyrisk.com. That's a place where you can get additional information about not just breast cancer, but other potential genetic and hereditary cancers, and have that information presented to your clinician, come up with a personalized game plan.
All right.
Very
Dr.
good.
Ifnat Stitt, and also a patient with hereditary cancer risk, Jody Lavery. Thank you so much for joining us here this morning. We appreciate the information.
Thank you for having us.
Have a great day.